Hi, I'm Sarita Stefani. I'm the CEO and co-founder of Amilis.
And hi, I'm Yasmin Baba. I'm co-founder and chief product officer of Amilis. At Amilis, we really just want to make preventative fertility treatments like egg freezing more accessible, affordable. We empower women to make informed decisions because it's such a personal aspect. There's so many factors that play into your fertility, but also your plans for family planning. So it's a really end-to-end experience across the fertility journey.
There's always an element of awareness that we have to tackle on a daily basis, and this is mainly on women's health. We have a lot of women coming to us with a lot of questions regarding maybe a condition that they could possibly have, maybe a lot of questions around the age. Am I too old? Am I too young? So there's always like this element of education and awareness that is always lacking, and that we're working towards it.
And a big challenge we face on the technical side is also working with clinicians and integrating modern technology into the patient pathway. So there's a lot of technology that we use in all different fields, which are super relevant within healthcare, but there's still barrier to access within an innovation in clinics.
I think there's always a question of responsibility, who has the responsibility to educate the population, to educate women around conditions that could affect their fertility. And I think, every single company, private companies that operates in the women's health space has a responsibility towards the public to provide reliable information women could agree on based on medical evidence, based on data, backed up by data. But I do also think the governmental organization, public health, have a responsibility in this, and they should deploy much more information and much more funding towards improving their system of communication with the patients.
In terms of patients and women, let's say, in general, there's such a lack of education when it comes to our reproductive and anatomy in general. We're not really taught much about this at school. If our parents or our friends are not really telling us about how our reproductive system works and what we should look out for as we age, it's really, really tricky. So I do think that there's a responsibility within the community, within clinicians, within corporates even. It's a great opportunity to educate women about their choices and hopefully mitigate some problems that we're seeing as women are continuing to delay motherhood. I think a great topic here is the workplace and the amount of time, stress, anxiety we have about our reproductive health, whether that's if we were to face infertility or are worrying about family planning when we're not yet ready to have children, but our biological clock is ticking. So there's a huge number of hours of women taking time off work to get their answers, to do their research. Women are 50% of the workforce. And I think employers now are starting to realize that it's time to invest in women's health. And they are doing that, with reproductive assistive technology and treatments like IVF, but also within menopause. And now it's slowly opening into the preventative space with hormonal health and things like egg freezing. 1% of funding goes to female founders, which is crazy in 2023. So in a room full of male founders, it's really tough to not feel imposter syndrome. But my advice is that there are so many investors now who are expanding their portfolio and actually targeting female founders. So as a female founder, you can also be picky with your investors. We really wanted to find advocates who are aligned with our mission, understand the importance in investing in female founders. And I think it's a trend that's growing now, and hopefully it grows faster and faster. But don't give up, and you're just as worth being in the room than a man. We had so much fun. The workshops were amazing. A lot of interesting perspectives from different people in the field, from entrepreneurs, researchers, clinicians. It's really unique. super interactive, and I think there's a lot of outcomes that have come out of this.